a good example is an antibiotic. Non-discriminate killer, go in, kill everything, and then hope that the odds are in your favor that you're going to get a positive result when they start to grow back. The defensive approach is to create an environment in which certain pathogens can't survive. So we're going to look at it from that aspect of prophylactically as well as from the standpoint of treatment, of developing a protocol that takes a defensive approach and prepares the ecology of the body as opposed to assaulting the body or using anything invasive in order to force it. We have to provide the basic building material. If the GI is impaired, there's no way that the adrenals can repair if it doesn't have the tools. Recognize, reduce, or eliminate the source of stress. This is the hardest part of the protocol. Like I said, stress is individualized. You have to help your patient to identify what is causing stress in their life over and beyond what they're able to deal with. If dysfunction will not stabilize or symptoms go away but return, look for a chronic infection. Cycling. If you're able to get this patient better for a period of 30 to 90 days and it starts all over again, you miss something and it's recycling. In most cases, it's a chronic infection and it's a pathogenic cycle that you will eradicate. In the case of parasites, you'll eradicate the live parasites, but once the ovum are able to mature, you get a reinfestation. So knowing how to use the protocols over a period of time in order to anticipate the recycling becomes very important. Establishing the hierarchy. You have to deal with the entire person three-dimensionally. You can't look at this unilaterally and focus on one specific aspect or another. It doesn't work that way. You have to treat the whole body. So while you're focusing on the adrenals, you have to be dealing with all of the tertiary problems at the same time. We start with the ecology. We're going to detox, recolonize, and reduce stress. That's the first 4 months. The first month, as we go in to the next section on detoxing and recolonizing, you'll see that we can do these things parallel, but they have to be done first. The adrenocorticoid problems have to be addressed in that first 4-month period of time before you can do anything else with the body, especially address sex steroids from any aggressive standpoint. Reestablish balance, normalize hormonal activity, neurotransmitters, electrolytes. As you go through module 3, I believe, has a big section on neurotransmitters. It all directly correlates with adrenocorticoid activity. So you have to understand what the impact on the brain and brain chemistry is so you can support that as well. As I mentioned yesterday, GABA has a tremendous amount of capability, especially as far as the pituitary, that it is absolutely responsible for the pituitary, the production of pituitary hormones, the utilization of pituitary hormones. So GABA plays a major role in a lot of what we're doing. You'll notice that it's in many of the custom formulations. Support while affecting core dysfunction, cure chronic nano-infections. If there is a severe disturbance, such as in the sexual steroids, we're going to support it. If they have any other problems, long-term medical history of problems that you have to support while going through this, don't neglect all of the other aspects. In most situations, we're not dealing with one problem. We're dealing with a multitude of problems. It's not one infection, it's a series of infections. And we too easily get locked into this, well, this has to be the answer. It's got to be this one thing. But in most cases, it's not. It's a whole, It's a whole series. And as one creates more vulnerability, those pathogens that are opportunistic will encroach on other tissues as soon as they see a vulnerability. Maintain a dynamic protocol based on the patient's monitor progress. To put a patient into this program and not to be monitoring on a regular basis, not to be changing the formulas as they need to be, I can't tell you, every once in a while we'll find somebody who's been on the same formula for a year. And that's because the practitioner involved hasn't retested or hasn't directed any focus on that patient. They did it once and there's no follow-up. This can't be done without follow-up. We can do a tremendous amount for you through SABR as far as maintaining this. But all we can do is remind you that the patient needs to be retested. We can't force the patient to do it. So a lot of the time you're dealing with data that's so old that it no longer gives you anything to work with. If you positively affected somebody and you only have the baseline from a year ago, you don't know where they are at this point. You have no idea how to reformulate. So you have to be concerned about if they're making the proper progress. If you see they're going in the wrong direction, by doing even an abridged analysis of just cortisols, DHEAs will give you an idea how to push them in the other direction. So regardless, if you're making good progress, check to see where they're at. If you're not making progress, check to see where you're not at. See, retest, retest, retest. It's really important. And all the data that you can get, if you can get serum values, a lot of the time what I do, especially if a patient is being seen by multiple physicians and out of that group there's one or two that absolutely believe in serum, well, as long as their insurance will pay for it, I don't see that as being stressful on the patient. So I will have them go and have a serum draw. The thing is that I will give them salivette to chew on at the same time that they're drawing the blood, so we can cross-correlate and make sure that what they're finding in the serum is what we're finding in the saliva. A lot of the time it's not, but one or the other will fit the clinical picture. The amazing aspect is it's usually the saliva that fits the clinical picture and not the serum. In the center, in the intestine, this is where life is. From a standpoint of Oriental medicine, you can't omit the root structure to the tree. You can have the healthiest tree there is. If you eliminate the root structure, the tree dies. Same thing is true as far as the gastrointestinal tract. There is no way to help to recuperate these patients if you don't have a GI that's functioning.